The Trump administration funding cuts are impacting Johns Hopkins University, a major research institution headquartered in Maryland. The university says 2,200 workers are now being laid off. In a statement, a spokesperson at Johns Hopkins says, quote, "This is a difficult day for our entire community. The termination of more than $800 million in USAID funding is now forcing us to wind down critical work here in Baltimore and internationally." Dr. Céline Gounder is here with me in Studio 57. Of course, she's a CBS News medical contributor and the editor-at-large for public health at KFF, but she also did about half of her medical training at Johns Hopkins, so you know this institution well. Good morning to you.
Good morning.
Explain to us how substantial these cuts are and what that really means practically.
Well, we're talking about $800 million in USAID funding, and that's just the beginning. We're also hearing about what we call cuts to indirect funding. So for the layperson at home who's not a scientist, direct funding is sort of like your groceries. Indirect funding is kind of like your pots and pans. And you need some of both to do science, just as you need some of both to make dinner. And we're hearing about cuts to those basic things that allow you to do research, like pots and pans allow you to do your cooking. So we're seeing another $200 million in funding cuts potentially in that kind of research funding, and then even more on top of that. And so this is huge. This is just the beginning. And when you talk about a research institution that is the #1 research institution in the country in terms of funding and the scope of its research, #1 employer in Maryland and in Baltimore City, the impacts are huge in terms of both science and employment.
And we relied on their stats during the pandemic to help us have a nationwide understanding of infections and deaths due to COVID. Let's talk about this a bit more practically as well, because they're also cutting grants for the International Institutes of Health. And there are concerns that could impact research for mRNA vaccines. What does that mean?
So first, I just want to make it very clear, mRNA does not change your DNA. Our body is really beautifully designed such that in the cell, you might remember in junior high or high school biology class, you have a cell with cytoplasm and a nucleus in the middle of the cell.
Right.
Your DNA is protected inside that nucleus. Your mRNA is in the cytoplasm of the cell. And the same goes when you get an mRNA vaccine. It does not go in the nucleus, which is where your DNA is protected. It stays in the cytoplasm. But people hear mRNA, they hear DNA, they think that means there's going to be an issue with their DNA. That is completely false. And this is kind of like flat earther thinking. It would be like saying the earth is flat and therefore we need to abolish NASA. Unfortunately, what this means is we've seen this backlash against mRNA vaccines. We are hearing that there are going to be terminations of all grants at NIH related to mRNA vaccines, and that needs to be confirmed. But that is what we're hearing now. And this is unfortunate because mRNA vaccines are used not just for infectious diseases, but we're seeing applications now for cancer, for autoimmune disease, for heart failure, for genetic diseases. And so this is a really important new tool that's very promising that's being taken off the table.
Well, we're very fortunate to have your insight on all of this, fact-checking and simplifying things that people get very, very confused by. Dr. Céline Gounder, thanks for being here.